Hi, today we are going to discuss about preconceptional counseling. When a couple come to us for preconceptional counseling, what all things we need to look for? These are the things which we are going to discuss in this video. So this particular topic can be asked for a short note, short essay or long essay for the postgraduate students, and for the graduates, it can be asked for a short note. Then some of the areas in this preconceptional counseling can ask for the multiple choice questions, and also some of the topic areas are important in focus of NCLEX RN exam. So let's go to the topic. Uh, First, we will see what is the definition of preconceptional counseling. Okay, preconceptional counseling is defined as the identification of social, familial, obstetric, medical, and lifestyle factors that can affect the pregnancy. Okay, so when a couple come to us, we will be focusing to find out the risk factors which is underlying with the social, familial, obstetrical, medical, or lifestyle backgrounds. Next, what is the importance of preconceptional counseling? First and foremost thing is it will help us to identify the high risk couple, the couple who is at high risk for having a baby with genetic disorders, a baby with metabolic disorders, or a couple who, a lady who can get complications during intranatal or postnatal period. All these risk factors we will be identified able to identify. So that is the first and foremost important, the identification of high risk couples. If we identify these high risk people, it will help us to prevent the affected pregnancies. If we are identifying these high risk factors in the couple, we will be helping them to overcome this, isn't it? So that helps in the prevention of affected pregnancies. Then also, the couple can be given information about their health status and its effect on their pregnancy. So they will be able to take an informed decision. And if all these things are happening, that will help us to reduce the pregnancy related risk. If the risks are reduced, the maternal and fetal morbidity is reduced. If the maternal and fetal morbidity is reduced, the maternal and fetal outcome is increased. And also, it helps us to support for a safer pregnancy journey. So, if you are linking your first answer with every points, you will be able to memorize all these points. Okay, first and foremost one is identification of high risk couples. Then it helps us to prevent the number of affected pregnancies, and also give informed reproductive choices, and also do a risk assessment and pregnancy planning. It helps to reduce the pregnancy related risk. It helps us to reduce the maternal and fetal morbidity. It helps us to improve the maternal and fetal outcome. And also it support for a safer pregnancy journey. So this is the importance of preconceptional counseling. Let's see what are the elements of preconceptional counseling. The elements with means what are the things which we look for in a person or a woman who comes to us for a preconceptional counseling. So it can be categorized into several headings. The first one is general health evaluation, laboratory examinations, evaluation of medical disorders, evaluation of genetic disorders, evaluation of previous obstetric outcome, evaluation of current drugs in use, evaluation of vaccination, evaluation of nutrition. Okay, so these are the things which we will look for. That is the elements of preconceptional counseling. Let's go to all these elements one by one. The first one, general health evaluation. If we consider the general health of a particular person, what all things comes in our mind? Height, weight, basal metabolic rate, blood pressure, and other systemic evaluations. So these are the things which we consider in general health evaluation. Next is the laboratory examinations. In preconceptional counseling, the laboratory examinations are focusing on to find out the hemoglobin level, and if the HB level is low, we will be considering peripheral smear and electrophoresis to find out the type of anemia and to find out the hemoglobinopathies like sickle cell anemia, thalassemia, and alpha thalassemia and beta thalassemia. If the patient is having iron deficiency anemia, the management is different. And if the patient is having sickle cell disease or alpha thalassemia or beta thalassemia, the treatment options are different. So according to the type of the anemia, we can plan proper treatment and counsel them regarding the treatment options. Next is the baseline blood sugar analysis. Then blood test to rule out VDRL, hepatitis B, HIV, hepatitis C, and sexually transmitted diseases. Next, titers of rubella antibody, urine analysis to rule out UTI, and pap smear. These are the basic investigations we suggest the person who comes to us for preconceptional counseling. Next, see evaluation of medical disorders. In evaluation of medical disorders, the first one we will be looking for anemia. If the lady who is planning to get pregnant has anemia, it is going to affect her directly or indirectly. If she is having an iron deficiency anemia, which we will be get to know through the peripheral smear, we will be starting iron therapy, anti-helmintic therapy, and dietary modifications for her. If she is having anemia due to sickle cell disease, alpha thalassemia, or beta thalassemia, she should be counseled and referred to a higher centers because she need proper monitoring and care. Next is heart diseases. If the particular woman has history of congestive heart failure, rheumatic heart diseases, or arrhythmias, it is going to worsen as the pregnancy advances. So we should give them an informed choice that there is a chances that your general health is going to affected with pregnancy, but still we can offer all the supportive measures, but they should be knowing all these complications, and we should give proper counseling and help them to take a proper decision. Then the diabetes, the blood sugar should be, if the woman who came for the preconceptional counseling is a type 1 diabetic patient, it is important to have a normal blood sugar level for the period of 2 to 3 months before trying to get pregnant. So it is important for her to have a normal HbA1c level for at least 2 months before she is trying to get pregnant. And during the counseling, educate her about the importance of following diabetic diet, the self-monitoring of hypoglycemia, hyperglycemia, and identifying the symptoms of diabetic ketoacidosis and its first aid management. Because if she is able to maintain her blood sugar level in a normal way, it will help us to reduce the congenital malformation risks. Okay. Then chronic hypertension. Uncontrolled hypertension can cause systemic complications like renal and cardiac complications. Then renal insufficiency. If a patient in end-stage renal disease wish to have a baby, it is important to counsel her that first go through a renal transplantation, then consider for a conception. Then thyroid disorders. This is the most common thing we always uh, meet patients with. We always meet patients with thyroid problems, isn't it? So it is important to maintain a euthyroid level before getting pregnant. So if your patient is hypothyroidic, tell her to maintain her TSH level less than 2.5 for at least 3 months before getting pregnant. So if now current TSH level is not normal, she should be taking the thyroid tablets. Then in every 6 to 8 weeks, she is advised to check her thyroid hormone levels. Once she reaches the target of less than 2.5, then it should be maintained for 3 months. Thereafter, she can try for pregnancy. And also educate these women about the expect an increase in the dose of 30 to 50% of their regular dose of thyroid hormone during the pregnancy level to meet the pregnancy requirements. Then HIV. If the status is known to be positive, counseling should be done about the effect on the fetus, and measures to reduce the transmission to the fetus should be taken, and they has to be referred to a higher centers, and the psychological support to be given to the couple. Then STD, both partners should be treated if they have STDs. Okay, next is the evaluation of genetic disorders. So the genetic disorders can be from the maternal side, paternal side. So it is important to assess the familial tree of this particular couple to identify these risk factors. If these risk factors are identified, more genetic counseling is needed, and we should refer this particular couple to for a genetic counseling, and they will get to know about the root cause of the problem and come up with the treatment options. So we would be looking for history of hemoglobinopathies like thalassemia, alpha or beta, and sickle cell anemia, chromosomal disorders like Down syndrome, Turner syndrome, Klinefelter syndrome, autosomal recessive disorders like thalassemia, sickle cell disease, and cystic fibrosis, autosomal dominant conditions like achondroplasia, Marfan syndrome, X-linked disorders like hemophilia, congenital metabolic disorders like phenylketonuria, galactosemia, congenital hypothyroidism, neural tubal defects like spina bifida and anencephaly. Next is evaluation of previous outcome. If a woman already has a obstetric history, she will be able to give us some hints about her pregnancy journey, and that can be considered for her next pregnancy as well. If she had any history of preterm labor, miscarriages, stillbirth, if she has a negative blood group, and it gives us an opportunity to identify any isosensitization has occurred or not. So these are the things which we will be interested to know if a woman has a previous obstetric outcome. Next, evaluation of current drugs in usage. Why this is so important, that some of the drugs which we use regularly can be causing tetragenic effects to the baby during the pregnancy period. So these medications has to be reviewed and replaced. So that's why it is important to ask about their medication history. So if there is a history of neural tubal defects in the family or in the previous pregnancies, it is important to start the folic acid tablets at least 2 to 3 months before conception. Then if the woman is using addictive drugs like cocaine or alcohol, she should be advised to stop all these things. Okay, then if the couple is using oral contraceptive tablets, it should be stopped at least 3 months before pregnancy, and preferably 6 months before planning pregnancy. And during that period, they should be advised to use barrier methods of contraception. Then tuberculosis. If the particular woman is undergoing the tuberculosis treatment, it is important for her to continue for her well-being as well as the baby's well-being. But the medicines like streptomycin, kanamycin, capreomycin has ototoxic effects, and pyrazinamide has low safety profile. Then hypertension. If your patient is having hypertension even before pregnancy, she might be on some ACE inhibitors. So that should be stopped, and she should change to methyl dopa or nifedipine, which is safer during pregnancy. And also diuretics are contraindicated during pregnancy. And the women who are at high risk for hypertension can be started with calcium supplements in order to reduce the risk of preeclampsia during the antenatal period. Then, if your patient is diabetic, the blood sugar level should be normal for 2 to 3 months before conception. And during the period of pregnancy, if the patient is on oral hypoglycemic agents for type 2 diabetes, that will be shifted to insulin. Then heart diseases, prophylactic penicillin treatment is started in rheumatic heart diseases as per patient's condition. And if she is using warfarin, that should be replaced with heparin. Then epilepsy. If a woman is having history of epilepsy, she might be using the anti-seizure drugs, and always most of the anti-seizure therapy is for run with the multi drugs. So that should be changed to a monotherapy in order to reduce the teratogenic effect after consulting with the neurologist. Then pregnancy is contraindicated in Marfan syndrome, aortic aneurysm, pulmonary hypertension, cardiomyopathy, coarctation of aorta, decompensated heart failure, advanced renal failure, advanced hepatic failure, etc. So they should be given an informed choice about it. Then evaluation of vaccination, antibody titer for rubella and hepatitis, that should be evaluated before pregnancy. If a patient has taken rubella vaccine within 3 months of time, she should be advised not to get pregnant till 3 months is finished. Then if the person who is approaching for a preconceptional counseling is at a younger age, you can suggest them to take a rubella vaccination, wait for 3 months, then get pregnant, because taking a rubella vaccination is an advantage because it helps to prevent more complications to the baby if you get rubella infection during the pregnancy period. Okay. Then if the chances of getting hepatitis B to the baby is more, so if the mother has taken the hepatitis B vaccination or not has to be checked. Then evaluation of nutrition. There can be various effects based on the nutritional level of the mother. Sometimes a lady might be obese. So if she is obese, there is chances for getting preeclampsia, hypertension, gestational diabetes mellitus, labor abnormalities, increased operational interventions, and preterm deliveries. And if she is malnourished, it predisposes her to a risk of premature labor, IUGR, intrauterine death, and accidental hemorrhage. Then she should be advised to avoid alcohol and caffeine. So these are the things which we will be discussing with the couple who come to us for preconceptional counseling. So these points have to be discussed while you give an essay. At the same time, all these points need not to be included in your essay because you won't be getting this much time. That much time to include all these information. But take all these information, process it, and make it an answer in your own way with the points which you are able to remember. So let's learn together with another video next time. Thank you.